To you across the WIDU radio network this morning, and we're live on Cape Fear Valley's Facebook page. I'm your host, Omega Jones, and today our focus will be the COVID-19 virus or the coronavirus. Now, our goal is to give you the latest factual information on COVID-19 and what this information means to you. Now, what we're doing this morning is we're inviting you to call in at 910-483-6111. That's 910-483-6111 to ask your question, or you can submit your question by way of Cape Fear Valley's Facebook page or Twitter, which is at Cape Fear Valley. Now, we will tell you what we know, and what we don't know, we'll tell you that too. Because the only thing that spreads faster than the coronavirus are rumors and misinformation. Now, today we are joined by some leaders in the local response to COVID-19 pandemic. You've seen our guests on either TV, you've seen them on YouTube and on Facebook, and they've all been answering questions about the coronavirus. First, we have Chief of Emergency Services and Associate Chief Medical Officer for Cape Fear Valley Health, Dr. Michael Zappa. Corporate Director of Infection Prevention and Control for Cape Fear Valley, Ms. Nygren, Carolyn Nygren. She will be with us later. We also have a lady who has a doctorate in public health. Now, what does that mean? That means pandemics is something that she spent years studying. And ladies and gentlemen, we have the Director of Cumberland County Public Health, Dr. Jennifer Green. And later in the show, we'll have someone to come in and talk to us about stress and anxiety from behavioral health. Well, Dr. Zappa and Dr. Green, first of all, welcome to the show. And as you can see, we're practicing safe distancing, which we'll talk about later. But let's briefly tell everyone about COVID-19. What is it?
So COVID-19, thank you for having us on the show this morning. We appreciate the opportunity. COVID-19 is a novel coronavirus. So that's a part of a family of coronaviruses. And we've known about coronaviruses before, but this is a new and novel one. It originated in Wuhan, China, and then made its way to the United States. And so we know this is a respiratory, it's transmitted via respiratory droplets, although we're still exploring other ways that it might be transmitted and through direct contact with another person. The common symptoms are fever, shortness of breath, and coughing, although those might vary from individual to individual, and they might be more mild in some and more severe in others.
Is there anything new on how the virus spreads?
So we're still learning that. We're getting our information from the Centers for Disease Control and Prevention and World Health Organization. There's been, in more recent days, we've learned more about airborne transmission or direct surface contact transmission, but we still think the primary way that it's spread is through those respiratory droplets, but we're exploring other ways that might be spread.
And when we've seen some of the success that other nations have had, particularly the experience in Singapore, what they observed is that the hand hygiene is the most important, even probably more important than wearing face masks. It's important of frequent hand washing, avoiding shaking hands, keeping your hands away from your face.
Symptoms, let's talk about that. Has any of that changed?
We're still looking for fever, coughness, and shortness of breath. And what we've learned again in recent days is that the level of those symptoms is going to vary between people. So some people might have more severe symptoms, those high-risk persons that we've been talking about for the last couple of weeks. But we're still looking for those three things, and it might vary from person to person. Some people might have mild symptoms.
All right. Now, is it true that some people are not showing symptoms, but they have tested positive?
It's possible. You could transmit COVID-19 and still be asymptomatic. We're still learning about how it's being transmitted. But still, the primary way that we think that this is being transmitted is for symptomatic people to pass it on to somebody else. But it is possible if you don't have symptoms that you can pass it on.
When you think about that possibility of asymptomatic transmission, which even though we don't know a lot about it, we have to admit that it is a real possibility. That's one of the big reasons why we're advising everyone to stay home. Don't travel if it's not necessary, because that's one of the biggest ways we're going to contain it. If you just stay away from someone because you say, well, I'm not going to go sit next to so-and-so because, they're coughing, they've been running a fever, but you go and interact with 10 other strangers, you really don't know who might be carrying. That's why, unless it's an essential public health, medical, safety function that you're performing, you need to try to stay home.
Let's go right into what everyone is talking about, and that is testing. Let's start with the hospital. What are you advising people who think they may have been exposed?
Right now, our advice is if you think you were exposed or you have symptoms of fever, lower respiratory problems like a cough or shortness of breath, unless you feel that short of breath that you think you need to be admitted to the hospital, our advice is to stay home and self-isolate. We are not testing people that would otherwise be safe to stay at home. We are currently reserving tests only for the sickest patients that actually need to be hospitalized.
Now, we have a couple of internet questions.
About the county. What's the county?
Okay. All right, Dr. Green, what about the county?
So we're going to follow the state health department guidelines for testing and those criteria that those put out. So I'd encourage people, as those criteria will change as in the coming days, to look at the website, the county's website, for those most current criteria. Again, everybody does not need to be tested. And I know that's challenging for the public to hear, but everybody does not need testing. We do not have the capacity to test everybody. The state lab doesn't have that capacity, and even our private labs. So we want to be able to test those that need it. If you're asymptomatic at this point, you don't meet criteria for testing. We want people to be tested that need to be tested, that are severe. But we're going to follow those state health department guidelines for testing. And currently, similar to what the hospital is, they're saying everybody doesn't need to be tested. And in many instances, it's safe to stay home.
All right, well, ladies and gentlemen, I officially want to welcome to the panel Corporate Director of Infection Prevention and Control for Cape Fear Valley. She's also an epidemiologist, and her name is Carolyn Nygren. She's also one that's on the front lines of fighting this pandemic that's going on, not only across the world, but right here in our community. Now, we already have internet questions. One question we had, and I will leave this to the three of you, a lot of folks are cleaning and they're mixing cleaning supplies. And some folks have come up with some toxic combinations. What can you tell us about that?
So we don't need you to mix chemicals. I think that's unanimous on this panel. We need you to read the back of the instructions on the labels. We don't need you to mix chemicals. That can create a really toxic environment. We're concerned about the health and safety of individuals. We're also concerned about environmental health at this point. So do not mix chemicals, follow the labels, directions, and use only as directed. And do not consume the chemicals either.
Absolutely. Just to put a realistic picture on it, when you mix certain types of cleaners, you can create an invisible gas that is actually toxic to your lungs and will bring you into the emergency department in severe respiratory distress. So you don't always have to see the fumes or detect something unusual. Just by mixing things that shouldn't be mixed, you are creating toxic gases. So follow the instructions. Any one cleaner, disinfecting wipes, Clorox wipes, Lysol, any one is sufficient enough to kill this virus on a hard surface.
So yeah, we've been getting a lot of questions about surface disinfection at the hospital, but also, our employees at home when they go home with their, badges and their stethoscopes and how do they disinfect. We are lucky that this virus isn't like C. diff. We don't need those higher levels of cleaners with bleach. So just to echo what has already been said here, just your standard cleaners will do the trick. Also, isopropyl alcohol with no other additives, like between 60 and 75%, can be sprayed on things to effectively disinfect fomites.
Now, Dr. Green, you had mentioned earlier, you were saying don't consume any cleaning supplies. Well, we have, there is something all over the internet, and there's all kinds of false information out there. And folks actually believe that you can drink water and bleach, and that will kill the virus.
So we've heard and seen that rumor on the internet, similar to, we don't want you to mix the product, cleaning products. We don't want you to ingest them either. We don't need, even if you mix it with water or any other liquid product, we don't need you to drink drink bleach in any combination. You'll end up with Mike and Carolyn at the hospital. So please avoid that. Please take those precautions. There are many home remedies that we've heard about. We want you to be very cautious before you consider a home remedy, including drinking bleach and water.
The number one way to keep from getting this virus is to keep your hands clean. Washing your hands with standard soap and water, not necessarily antibacterial soap and water, and using alcohol-based hand sanitizer. These products are designed to keep us, from spreading things to ourselves from our hands and also to others. So I think we've mentioned wiping down surfaces frequently, keeping your hands clean, and being mindful of when you're touching your eyes and your mouth and your nose.
That's a great point. And I'm a contact wearer, so I feel like I need to touch my eyes all the time. So, and that's hard for folks to do, but do your best not to, especially if if your hands are not clean and you've just touched a surface or been in a setting where there are other people. You definitely don't want to touch your eyes or your nose or your mouth right afterwards.
Jenny, you had a question?
We had a related question, yes. Everybody's getting a lot of packages delivered, Amazon, etc. Do we need to take any precautions with those packages before opening them?
At this point, the CDC guidance has said that you can accept those packages as is, and you can open them if you don't need to use gloves to open them, but you can treat them as normal.
What if someone has been to one of the states that's had a big outbreak, like New York, Washington State? Should they be on hyper alert?
So what we know about traveling to those infectious areas is similar to what Dr. Zappa said. We want you to stay home, and we want you to monitor your symptoms. So if you've been to an area where there's an outbreak and you're traveling back, we want you to stay home, avoid going to work if possible, self-monitor, take your temperature twice a day, give your healthcare provider a call first if you do have concerns, but check yourself for fever, shortness of breath, and coughing.
And if you can do your work from home, now's the time to do your work from home. If you work at a computer, those are the kind of options that can help protect that kind of spread.
Let's talk about the most vulnerable, meaning they might have complications if they were to catch the virus. Who would that be?
I think when we look at that group, we've established that it's the elderly that are at risk, but not strictly the elderly, but they're definitely high risk. Any patient with chronic diseases, chronic lung disease, diabetes, heart disease, and anyone who's immunosuppressed. When you think about our efforts to try to say, hey, I'm going to be okay. I don't have to worry if I get it. I'll bounce back after a few days. We have to really, if there are any threads of altruism within us, this is the time where they have to come out. There is no time for any of us to be selfish right now. By following the rules, by the appropriate hand washing, by staying home if at all possible, you're protecting that vulnerable 1% of the population. It's all of our jobs to help protect the elderly and those with chronic disease during this time.
Would asthma be considered one of those diseases that you would put in that list?
Yes, it would.
Okay, all right. Now, I have heard about half of the people that have the virus in New York City are between the ages of 18 and 49. Now, is this because young people think they can't get the virus because we're always talking about older folks or those with certain conditions?
So the virus can impact anybody at any age, any race, ethnicity. What you heard Dr. Zappa say is that for older people, it's the symptoms and the complications can be more severe, but anybody can get it regardless of age, whether you're 2 or whether you're 15 or 45 or 35. You can certainly be impacted by the disease. And we've heard a lot about young people not practicing social distancing. We've seen the news stories about spring break, but I also want to kind of flip that a little bit. Our young people are also the ones that are very good at using social media to get the message out about COVID-19 and how we can practice social distancing. So I want to encourage us to encourage our young people to use social media so we can get those messages out from credible sources.
Well, ladies and gentlemen, we are in the middle of a very special edition of Cape Fear Valley's Making Rounds Live. Today, we're talking about COVID-19 or the coronavirus, and we are joined by some of the leaders in the local response of the virus. We're going to take a break. When we come back, this conversation continues. Making Rounds Live. Make sure you stay close.
Wouldn't it pick up? I have 2 more questions. One you know about already, the drive-through
Okay.
testing. The other one is probably going to go to you, Dr. Zappa, but I'll let you guys choose. We had someone on Facebook have a question, and I've been hearing it too, that certain medicines make it worse, like Motrin. And blood pressure medicines. She specifically asked about blood pressure medicines. Are those okay to take?
That's the first I've heard of that.
That's the first time I've heard that too, but I've heard
Maybe get the message out.
Yes.
like albuterol, that was the one I had myself.
Corticosteroids should be avoided.
They should, so
They
if I
should be.
feel short of breath, don't take my albuterol.
So I can't use my inhaler if I need it? Is that what you're saying?
If you don't, if you're sick and infected, if you typically use your inhaler, a steroid inhaler, to prevent your asthma, you should not stop taking it. If you develop fever, cough, shortness of breath, then don't use it.
We should say the same thing about ibuprofen, because I've heard some people are just
Stopping it altogether.
Stopping it, period,
Right.
yeah,
And we
exactly.
need, we need
So
to
I
get
just want to
your
make
asthma
sure
medicine.
that's an important one. I'm gonna make
Yes,
sure
no
we get that
problem.
from here.
No problem.
Back for free. I mean, not, whenever it fits in, I just, you know, I'll just fix
You're
it.
one step closer to becoming you.
Well, Facebook, thank you all for joining us today. If you have any questions, get those questions out. Miss Jenny, she is monitoring the comments and she's getting those questions. And once again, we have a panel of experts. These are our local, you might as well say the lieutenants of this pandemic. So let everyone know what we're doing. If you have any questions, get those questions to us. We will get them answered, and if we don't know the answer, we'll tell you. We don't know the answer, we'll tell you that too. But thank you all for joining us.
We want to, is it safe to donate blood too? That's another thing that's come up.
Yeah, we need
Because
to
we're
hit
about
that.
the schools, we get a lot of our blood from the schools, and so we've lost a lot of donors with school being out for the rest of the year.
Yeah.
We're losing a lot of donors that way, so.
And the other
Okay.
thing for donation.
1, 2, 1, 2, check 1.
We're running
1,
out of
2, 1, 2.
hospital.
Welcome to Cape Fear Valley's Making Rounds Live, 1600 AM WIDU, the We Do Radio Network, and we're streaming, okay.
Special recognition letters and legal research.
Apologies, guys, we have one mic before we go bad.
Dr. Zappa.
Sounds strong.
Oh, I'm sorry.
No,
Should I
no,
move?
fine. No, you're fine.
Oh,
It's all-
I was gonna say, they were my mic.
That was your mic?
I think
You want me to leave this, is this the right direction for that? Is that good?
Well, I pointed towards you would be the desk. Front.
Okay.
Oh, they're flying it now.
the questions.
Yeah, I was gonna start writing some of them down.
Okay.
But your, like, food delivery drivers, are they safe and what precautions can they take to stay safe if they,
Knock it at the door.
right? That's what I'm
Yeah.
gonna
Wash your hands, carry hand sanitizer in your car.
Do they have to sign like a tablet when food is delivered?
Well,
Can we put a
we
fourth place
DoorDash,
here?
and so you can,
Oh, one, okay,
there's
that's,
an option that they built into
So
the
what
app,
we
you
can
can have
do
them just
is-
drop it at the door.
Okay.
And you don't have to sign for it.
Yeah.
That's it.
That's what it is.
I think the question is coming back with
And the same thing for grocery deliveries, if they want to do that.
It's nice to
I
meet you.
love that.
I know, I've
Yes.
heard your voice many times,
Yeah.
and I've seen your name and heard about you,
Same
and you're famous as well, so nice to meet you.
You too.
You're famous at the health department.
Oh,
Yeah.
well, you're famous over at our house.
So you should set it by tenets of, the effort. I think you should be the kernel of COVID.
question coming.
Okay, I like that. I like
Good.
that. Yes. Kernels of COVID. I like that.
Yeah.
We have a
Back and
call.
forth.
Can we let him, I'll tell him to ask his question,
Do you want me
then we'll
to
turn him
slide it
off.
over?
Okay,
Okay, is that all right?
yes.
I'll ask him to be brief.
Officially postponed until 2021.
Thank you.
The International Olympic Committee, along with Japanese Prime Minister Shinzo Abe and local organizers, have decided that the Tokyo Games cannot go ahead as scheduled this year because of the coronavirus outbreak. Illinois Cooper is ordering tighter assembly and business restrictions to attempt to thwart the spread of the new coronavirus. He also says public schools must remain shuttered for several more weeks.
So the governor hasn't announced.
Okay, so change the governor, no shelter in place.
No.
Despite the pressure.
Yeah.
Hmm?
India. They went on
Really?
lockdown.
What's that?
India,
Oh,
It's dropping.
they went on lockdown.
Oh, they went
Nationwide lockdown.
These are just what we were talking about, just in case, I didn't know if you were writing them down.
Mhm.
And that was the one that I think you were talking when I was just asked that.
Yes.
She wants to know not just are they safe for us, but the drivers, what
Well,
precautions should they take?
yes, that's true though.
That's a good question.
true, though. So which one do you want me to go first? 'Cause
I
you
don't
got
care what
4
order,
here.
I was just making sure so we didn't accidentally skip one that in the break that you had a copy of what I'm getting that we haven't answered on air yet.
Okay. So
Trying
you
to take
still
notes.
want me to go to you? Because you.
I mean, I don't
how
have a
do you
mic,
want to
so
handle that,
how
darling?
do you prefer to do that?
Because she don't have a mic.
Okay,
Yeah.
all right, I got it.
Might be something, if we have to holler one, that's what we're gonna do, but otherwise than that, that's fine.
Okay,
How we got it now.
Cool.
okay, let Wes know that,
What's that?
Do you need me to
Oh,
pull
sorry,
that for
that's
you?
okay, never mind, we're good.
We are getting phone calls, and if, Deacon, if you would ask your question, our panel of doctors are standing by. The way we'll do this, everybody, you'll ask your questions, and then our medical team will respond to you. Deacon, please ask your question, sir.
Okay, my question is more or less a rhetorical question, but I wanted to just reaffirm what the experts have already said. I'm one of those type of people that always trying to improve somebody else's product they done spent thousands of dollars to make. And when it comes to cleaning products, I use a lot of bleach, but I was cleaning my bathroom and stuff, and I want to get it clean in a hurry. So I mixed up some bleach and some ammonia and all that, and some other chemicals together. And I almost had to tear my wall down to get out of there. Even when I opened the windows, the stuff burned me all down in my lungs and everything. So only thing I say, listen to what these experts are telling you. Utilize these products the way they were designed. But mixing them don't necessarily just mean that's to burn them all together. Mixing them mean like the gentleman that's sitting on the panel say, when you put them in the same room, they create certain gas. And I'm telling you that fumes and gas is put me all out of my lungs and everything. Please don't mix the chemicals.
Well, ladies and gentlemen, once again, you've just heard a stress of what our panel of experts have already told you about cleaning supplies. Don't mix it. Make sure you follow the directions and do not ingest the cleaning supplies. Now, we do have another internet question, and they're asking about food delivery drivers. First of all, are they safe? And second, what precautions should the drivers themselves take?
So we know that food delivery can be critical for those that are not able to leave their home, especially if they're in isolation or quarantine, or they're an older adult, or they might have something else going on, they are not able to use their home. So it's important that we're able to access those food delivery services. What I've seen on apps these days is that they have an option that you can leave the delivery at the door, or you can leave a note for them in the app or online when you order to leave it at the door so they don't have to come into your home. And then we'd of course encourage those delivery drivers to have hand sanitizer in their car. And we know that they don't have access to soap and water all the time, but they can certainly sanitize before they pick up the delivery, after they pick up the delivery, and then after they drop it off at the home and use that hand sanitizer.
And now another question that we have, drive-through testing. Does it encourage ill people to leave the house?
So we've been getting that question a lot, and so we're making considerations for that. We want people to avoid exposure to the public as much as possible. We want you to stay home. If you're sick, in particular, if you're severe, we want you to go to the hospital if you are having severe symptoms enough to be hospitalized. So one of the things that we're trying to put in place today is to do that drive-up testing, but also have people not get out of their car. So the persons that are being, we're doing the test collection for are staying in their car, they have a mask on, and then the health department staff have full PPE on. So we're trying to avoid that interaction with the public, but that is certainly a consideration. We want people to stay home if you're having mild symptoms and avoid the public as much as possible. So as we assess, what I've been saying in the news today is that this is a pilot project for us. We're trying to see what the quirks are, where we can make improvements. And so that is certainly a consideration that we're making as we kind of assess the effectiveness of this.
Well, ladies and gentlemen, you're listening to Cape Fear Valley's Making Rounds Live, a special edition, because we're discussing COVID-19 or the coronavirus. And we have the kernels of COVID-19 with us today. Dr. Michael Zappa, Chief of Emergency Services and Associate Chief Medical Officer for Cape Fear Valley. We also have Ms. Carolyn Nygren, Corporate Director of Infection Prevention and Control for Cape Fear Valley. Dr. Jennifer Green, you all have been listening to her this morning. She is the Director for the Cumberland County Department of Health. And we have Mr. Mark Gronsky with us. He is administrative with Cape Fear Valley Behavioral Health. And he's going to talk to us later in the show about the stresses and the anxiety. But right now, I understand that there are medications that we need to avoid.
Yes, there are. So certain medications, steroids and what we call non-steroidal anti-inflammatory drugs. Common ones would be ibuprofen, naproxen, or naproxen. Those need to be avoided when you're sick. So you don't have to stop using those medicines if you're not sick. But if you were to have symptoms of COVID-19, the recommendation is to avoid those medicines.
Let's talk blood donation. Folks are really, they don't know what to do. Should they donate blood during this time?
Absolutely, it's critical because we are at critical levels. You know, the rest of our patients in the hospital, despite this COVID pandemic, they're continuing to come in. So we still need blood for for our community, for our trauma patients, for our patients undergoing surgeries. So please continue to donate. We encourage you to call ahead. Call the Blood Donor Center and you can get a specific time to come in and donate blood. But there is no risk to donating blood, and we need it as much, if not more than ever.
And donating at the Blood Donor Center, that blood stays in this community also.
Yes, it does.
Now, we have another internet question. Can there be other symptoms besides cough, fever, and shortness of breath?
Well, we're still learning about COVID-19. Those are the three things we're really looking for. It gets confused, I think, with it's the height of it's allergy season just kicked off. We're still in flu season. So we want people to look for those three things, but people might have a runny nose. If your coworker coughs, I don't think it's a time to panic. They could be coughing for many other reasons, or if they have a runny nose. But those are the three things that we're really looking for.
We've recently seen on the news too that over in other countries, one common thing seems to be people may be losing their senses of smell and taste. Have you heard that? Is that
I haven't
true?
heard.
I haven't heard that.
I've not seen anything in reality with that yet.
Yeah, I've not seen that.
Is the coronavirus more contagious than the flu?
That's a good question. I think we're still learning about how infectious this is, and how it spreads. So, if we think about something that's very infectious like measles, I don't think we think it's as infectious as measles, but we're still learning the other ways. And I'm going to actually pump that to you, Carolyn.
So one thing that we need to really pay attention to when we're talking about social distancing and staying home when you're sick or when you're not sick, if you can, is that nobody has immunity to this disease yet. When we talk about flu, we get our flu shot every year. We may have had certain strains of the flu in the past that provided some immunity for the future. So in that sense, it may be more contagious than flu.
How long is someone contagious?
Go ahead.
2 to 14 days is what we're looking at. And that's that varies from individual to individual. So some people might have very mild symptoms in 2 days, and some people might not get sick for several days. So we provide a broad range, but that's what the best evidence that we know now is 2 to 14 days is when that's gonna show up.
If you look at it from a practical standpoint, new guidance says if clinically you're diagnosed with possible COVID, because remember we said before that we're going to decrease the amount of testing that we're doing. So if you have symptoms consistent with COVID-19, the fever, the cough, mild shortness of breath, and you're advised to stay home but you never got tested, you're going to need to stay home for a minimum of 7 days, and at least 3 of those days have to have been without fever towards the end. So it's not always a guarantee that everyone's going to be out for 14 days. It could be as short as 7. So the minimum is 7 with at least 3 days of no fever, and that means no fever without taking Tylenol or acetaminophen.
We have another internet question, and I'm so glad they asked this question. They said you mentioned seasonal allergies. How can we tell if it's allergies or if it's something more severe?
So allergies, if we think about the symptoms, so fever, cough, shortness of breath, as Dr. Zappa said a few times, if you have those, we want you to stay home. If it's severe, if you're having respiratory issues strong enough to go to the hospital, we want you to do that. That typically doesn't happen with allergies. So we want you to seek medical care. And then you can also talk with your provider about, call them first and talk with them about what symptoms you're having. And they can help differentiate.
Probably the biggest factor, it's pretty rare for seasonal allergies to get a significant fever. The other symptoms, the congestion, the runny nose, a cough, sometimes from a postnasal drip, very common. And the other point, think about your own personal history. When there's yellow all over your car, does this happen to you every year? Well, it probably is your seasonal allergies again this year.
and have you traveled, right? So if you are having symptoms and you traveled and you have somebody that you know that had a positive case, you know, that history, your personal history helps you differentiate as well. So we have to put all those factors together rather than just saying, well, the lady at the grocery store coughed and now I'm going to get it. We want to make sure we're putting all the pieces together.
All right, Colonels, how am I going to protect myself and my family?
Well, I think what we'd all agree on is stay home if you can. We know that there are critical public health workers, healthcare workers that work in all of our buildings, and they're at work, and we appreciate them being at work. But we also know that if you are not in a critical field, that we want you to stay home to the extent possible. And then we've also talked about washing hands quite a bit today.
Surface disinfection. Staying home, like Dr. Green said, is not possible for everybody. But we at work are still practicing a level of social distancing. So large meetings, gatherings, standing, within 6 feet of a coworker, we don't need to do any of those things right now. So we can have, it's 2020, so we have WebEx, we've got all kinds of different ways to have virtual meetings, to have FaceTime meetings. So utilizing those and keeping your own sort of 6-foot personal bubble is really imperative right now.
And I'd like everybody to think of it on the flip side. How many times have any of you who have busy lives thought about, wouldn't it be great if I just had a little time to stay home?
Yes.
I'd love to organize my garage, clean up my attic, put all those family photos in a catalog and get them right. So think about things that you can do and take advantage of the family time. Schools are closed, young kids are home, college kids are home. So whether you're having to stay home with them or you're a parent working and have to come home and then have them home, look at this as really a unique situation. I'm confident as we look back at this next year, many of us, if you take advantage and make some good memories during this time, it'll make it a whole lot easier for us and kind of keep us with the right mental focus.
And the other thing as families prepare is we want to be cautious about hoarding supplies. Mm-hmm. So when you go to the grocery store, we want you to certainly be able to get your roll of toilet paper and your hand sanitizer and your cleaning products, but be reasonable in the amount that you get for your household and get just enough for your household and then leave the rest for others. There is a nationwide shortage of PPE, personal protective equipment. And the teams that are on the front line, our staff, the health department staff, the Cape Fear Valley staff, other healthcare workers, we need access to those things. So if we don't have access, it makes it challenging for us, and we got to get very creative about how we're going to have PPE. So be mindful of that as you are shopping in the grocery store and buying those things for your household. Get things for your household, prepare for your household, but don't do it in excess.
Now, I understand we have a phone call. Go ahead, caller.
Yes, good morning. Very good information. I have one question. I'm hearing that once the person contracted coronavirus, that after, if they make it through, I hate to say it like that, but when they make it through, that they are immune from getting it again. Is there any truth to that?
His question was, if you've had the coronavirus and you got over or you were healed from it, can you get it again?
So like Dr. Green had said, we're still learning a lot about this. This is a very novel, very new strain of coronavirus. But if we look at MERS and we look at SARS and we look at how these viruses typically behave in humans, it's very reasonable to think that there would be some immunity to it after you've convalesced and gotten better.
Food prep. We have an internet question. Can the virus be spread by food prep at restaurants, or is it cooked out of the food? And what if restaurant workers don't know they're sick?
So we want restaurant workers to be able to stay home if they're symptomatic or they're feeling sick. And that's the same for any employee anywhere. If you are sick, we want you to stay home. We also know what is true is that sometimes in the restaurant industry, people do go to work sick. because they're working minimum wage jobs. But we really encourage those that are sick to stay home. We also encourage those that are in the restaurant business to utilize, take special precaution and wash their hands on a regular basis when they're preparing food, making sure they're cleaning and sanitizing the facility that they're in, and taking those precautions when they're preparing the food so that it's safe for those that are consuming the food.
Let's talk about community spread. I've recently heard that term. What does that mean?
So social distancing, right? Community spread is about when we don't know how a person got the virus. So we don't know that they don't have a travel history to New York or to international travel, and they don't have connection to a known positive. So then we talk about community spread. Somebody in the community gets it, and we're not sure how they've got it because they don't have a connection. And so we've talked a lot about social distancing. Because we do have community spread in North Carolina, it's important that we stay at home to the extent possible. We practice that social distancing. Yesterday, I would have said, don't go to the barbershop or the salon, but we don't have those options right now. But we want to stay away to the extent possible from mass gatherings because we do have community spread here.
Social distancing, you've mentioned that quite a bit. We see all these closures, schools are closed, businesses, etc. Can someone explain the science of social distancing and why we're doing it?
If you look at now that we have community spread and you look at what we're trying to accomplish, we're trying to accomplish two things. We're trying to flatten that curve so that we don't continue to have this rapid rise of cases. And the whole reason we're concerned about that is because we want to protect that vulnerable portion of our population. To protect them when we don't know where it's coming from. It's only coming from humans contracting it either directly from droplet or picking it up on a surface. So think about it. Whether you get sick or not is almost entirely under your own control. If you stay home and go nowhere, and you know the people in your household and they've stayed home, or when you've gotten food delivery, you can't get it. It's not going to just float in the air, come in your backyard, and come in your door. So it is totally within our control. So if we can exert that amount of self-control, and if we can be unselfish and think of the people who are really vulnerable, that's the value of the social isolation, because we will stop it.
And Carolyn talked about it's hard for people to do that, but you might have to, instead of going to visit your grandma, you might have to FaceTime with your grandma or Skype with them or use technology. And that's hard for people to do because we're humans and we want to hug and touch people and be next to them. But we have to utilize technology to the extent that we have it, and delay that social visit, that visit to your neighbor. We'll have time to be able to get there, but avoid that to the extent that you can.
So, and Dr. Zappa talking about flattening the curve, for anyone who doesn't know what that means, an epidemic curve looks like this, and then it ramps up and then it wanes. When it's at the very top of that curve, it's a time when the most people are sick at once. This is what we're concerned about with our hospitals, with our resources. If we flatten that curve down, it means that maybe the same number of people will get sick, but over a longer period of time, and that way we can manage this new disease well.
All right. We have a phone call. Go ahead, caller.
I'm calling to find out if you have a child who's coming back from out of town, they lost their job, and they're coming back to stay with you, and they've been staying in a group home with other young adults and all that, and you're a senior, what you can do if they're coming to stay with you?
That's a tough question. So we know that in congregate living places, in dorm rooms, and maybe in some group home settings, that those folks can be at higher risk because they are in very close settings. The caller also mentioned senior citizens, so that group is also higher at risk. And then we've also said we want you to stay home, but you're together in the same home. So that creates certainly a challenge. If it's possible, you can think through with your family member about how to isolate within your home. So if you have separate bedrooms, and then making sure that the common spaces that you do share are cleaned appropriately, don't share food, don't share utensils, don't share the same towel and washcloth. If possible, don't share the same bathroom. So there are some things that we can do, but we still, my thought would be to isolate within your home to the extent possible.
Now, we have an internet question. What do people take to cure the virus?
So currently, there is no cure. But remember, 99% of the people are going to do just fine. Your body's own natural immunity will help you get better. So that goes back to some of the things we were talking about before about mixing chemicals, diluting bleach, doing silly things to put into your body. So the answer is right now, despite what you read on the internet, there is no cure, there is no treatment. You use regular over-the-counter medicine that you would use for any respiratory type illness. When you think about the prevention, you want to keep yourself as healthy as possible. So that means get the right amount of sleep. Figure out how to exercise still in your house. Just because gyms are closed, that's not your free pass to say, hey, I don't have to exercise for the next 2 months. Sorry. And take your vitamins, eat healthy. That helps keep your immune system up and will increase your probability of getting through it quickly if you were to get it, and hopefully even prevent you from getting it in the first place.
All right, another internet question. With the new bans from the governor, are there any changes to labor and delivery? And can new moms still have a support person?
So I can speak for what we're doing at Cape Fear Valley. We do allow one support person to be with mom during delivery. And just to clarify the whole visitor issue, for everyone's protection, for our community, to keep our vulnerable citizens safe and to decrease the spread of this, we have restricted visitors completely at all of the Cape Fear Valley facilities. The exceptions are a support person for a laboring mother and someone who is actively dying. We would allow visitation there.
And that's consistent with what we're doing at the health department. We rolled out our visitor policy yesterday. So we are also limiting visitors into our building. We're screening at the door similar to the hospital. And then we're limiting visitors. And our exceptions are if you're here for a child appointment, we need the parent or guardian to go with that person, one visitor. And if you're there for WIC, similar as well. If baby is the client that day, then of course mom or dad can come along. Or if mom and baby are the client that day, then they can have one visitor. So there are some limited exceptions, but we are limiting visitors at the health department.
All right, another internet question. Are there long-term effects on a person's lungs who have recovered from COVID-19? There are rumors about long-term effects.
At this point, we don't have evidence for that. So when you recover, it's expected that you would recover just like you would from any other respiratory infection. The patients that have severe respiratory infections like pneumonia, there are thousands upon thousands of people who recover fine from pneumonia every year and go back to their normal lives.
It's important when you're reading things on the internet and, all of these stories that are coming out about COVID-19 to remember that much of the data that's coming out of these other countries and areas are based on a subset of people that are only the most severely affected. So it's very important to remember what Dr. Zappa said. 99% of people are going to be just fine. And these, scary stories that are coming out are probably more toward that 1% of more severe disease.
And it's going to take us a while. I mean, if we think about Ebola and SARS, we're still learning from those outbreaks, and those have passed. And so it's going to take us a while to really drill down into the data, and I'm putting my researcher hat on, and it's going to take us a while to figure out, okay, what are the exact outcomes of this? what are the long-term effects. For some of this, we won't know for a while.
Dr. Green, if we're told that we have to go into self-quarantine or self-isolation, what advice would you give us?
So if the health department or your healthcare provider tells you that you need to go home and isolate or quarantine, that means we need you to stay home. We don't need you to go to the grocery store or to the mall or to your neighbor's house. We need you to stay home. When we have a person that we're testing, we do what's called a needs assessment. So we're going to ask you about how you get food. Do you have someone to watch your dog? Do you have childcare? Do you have all of those things that you might need when you're in isolation? We're going to ask you who else lives in your home. Do you have other vulnerable adults that live in your home? And if you do they have somewhere else they can stay? If not, do you have another room you can put them in? So we will walk you through all of those questions and guidelines and instructions for staying safe within your own home, in particular if you have others in your home along with you. And then the other thing we ask you to do is when you are in isolation or quarantine, we want you to keep in contact with us. So we will ask you to take your temperature twice a day. And if you do have severe symptoms or your symptoms progress, we're going to ask you to call Cape Fear Valley and call your healthcare provider and go to the hospital if those get severe enough for hospitalization. So we want people to, we know that it is mentally taxing to stay in your home for many days in a row, but we do want people to do that and follow those guidelines, and that's to protect yourself and the safety of others in our community.
I have seen some folks treating all of this like it is a snow day. They're still having gatherings at their house. They're still having play dates. What do you have to say to those people?
Stop.
Please,
Okay.
Yes.
please stop. There's a lot of things on social media. There's a lot of, selfies that, going out and being in large groups. Right now is past the time to start staying home and avoiding these events and these gatherings. What if someone in your family becomes ill with this, someone old or immunocompromised, maybe they're going through cancer treatment, becomes ill with this, and then we don't have the resources to take care of them because everybody got sick all at once. We can't afford to be gathering in and making these poor choices right now.
Is it true, because I've always heard what I thought was actually good advice, that you should act as if you have COVID-19, and that should help you protect yourself and others? Is that good advice?
So many of the things we're going to tell you to do if you have COVID-19 are many of the same things that we tell the general public. We want you to have stay home if you can. We're going to require you to do that if you're a positive case, but we want you to stay home. We want you to wash your hands. We want you to avoid touching your face and your eyes and your mouth. We want you to clean your house, especially if you have others in your household. So those are all good everyday precautions that even in the height of flu season, we would have asked you to do. Stay home if you're sick.
Okay. Now, I understand we have a caller. Good morning, caller.
Good morning.
Go ahead with your question.
Yes, I was wanting to know, what is the incubation period of the coronavirus disease?
So it's 2 to 14 days.
Okay, 2 to 14 days.
I think the average is about 4 to 6.
Right. All right. Ladies and gentlemen, we have there's Mr. Mark Gronsky. He has been sitting over here so patiently during this whole interview today, and he is with Cape Fear Valley Behavioral Health, and he is here to talk to us about dealing with the anxiety and the hysteria of COVID-19. First, Mark, thank you so much for being with us today.
Glad to be here.
Now, a lot of people are anxious, they're depressed, or they're just plain scared. Is it normal to be this way?
I think certainly it is. I think with what we're dealing with, all the news media we get, all the social media, all the alerts that we have. So I think there's some sense of normalcy that people are going to be more anxious or feel more depressed. And so then we got to recognize that that's there. At the same time, I would make sure that we're reaching out to family members to communicate with one another. If you have a mental health professional that you're working closely with, making sure that you're having those regular contacts and regular visitation. Because obviously something like this can increase those symptoms and exacerbate those symptoms. And if those are persisting, then definitely we want folks to be able to reach out for help, getting to their therapist or their psychiatrist. But also recognizing that with this heightened level of anxiety we're all in, that there is this normalcy to some of these things that we're feeling.
Now, what can we do to relieve some of this stress?
I think the first important thing is to make sure that we're maintaining some level of routine. Things seem kind of chaotic and always changing. So I think being able to make sure that we have some sense of routine, whether it's at work or at home, try to engage in those regular kinds of things in order to manage. I think it's important to take a break from all of the news, maybe from a while, some of the social media, just to kind of get away. And do things that you normally would, whether it's exercise, as Dr. Zappa was talking about, reading, watching TV, spending time with your family. Doing those things that can be kind of stress relievers for yourself are important. Obviously, we want to be mindful of that social distancing, but being able to go out for a walk or exercise, making sure we're kind of keeping that appropriate space. But doing those things that can help individuals relax, I think, are important.
Now, we have an internet question. For those who are very introverted, what are some practical ways to deal with getting no alone time with family around all the time?
I think that's a good question. I think some of that may be just making sure you're having those conversations with your family and scheduling some of that time. It seems kind of maybe odd to say, but if we're all in the same space together, being able to have that routine and scheduling time where, all right, I'm going to take 10, 15 minutes, a half hour by myself. And the rest of the family's aware of that, so we can be able to acknowledge that and be able to work together on that. So I think it does require a little bit more work in terms of the family coming up with maybe some new rules because we're all in the same space together. Being able to kind of recognize and respect each other's, whether they're introvert or more of an extrovert. Being able to provide that within that context of the family.
How do we talk to our kids about this?
I think as parents, I think the first important thing is to make sure that we're remaining calm. I think our children kind of model and they see, they model after how we're experiencing that. So if we remain calm and confident, then I think that's going to be helpful. But I think it's also important to talk age appropriately with our kids. So our older kids who might have more knowledge or our teenagers, I think it's important to make sure we're sticking to the facts and answering those questions, regardless of the age, but making sure that it's age appropriate.
And what advice or what are some ways, because I'm trying to talk to a 6-year-old
Sure.
and explain to her what's going on. And after about the second question, I'm like, baby, I don't know. So what advice would you give to grandparents who are trying to explain why their grandbabies aren't in school?
Sure. I think certainly being able to hear from that 6-year-old what their concerns are, I think letting them know that obviously there's, we can't be in school right now because of this virus that we're all kind of dealing with. I would encourage people to make sure we just remind them of the appropriate things we've all talked about in terms of maintaining good hygiene, those kinds of things to manage that. But right now we're kind of all in a difficult position. And we need to be able to kind of make the best of that in the home and being able to kind of modify what we're doing, that it's not the same right now. And then we need to be able to kind of have some ability to adjust and be flexible.
Okay, well, I'm bringing my personal home in this right now.
Sure.
When she asks, what's the virus? How am I supposed to explain what's going on to a 6-year-old?
I'm sorry, what was that?
When she asked me, when I tell her you're not in school because everybody's, there's a virus. Yeah. And then she says, well, Cece, what's the virus?
Well, I think we need to be able to explain to a 6-year-old what those symptoms are. I mean, that this is a virus that people can get a fever, they can get shortness of breath, but that it's impacting potentially lots of people. Okay. So I think we need to be able to communicate the facts at an appropriate level. And so you may not get into all the specifics as you would with a teenager or a 20-year-old, but being able to let them know that these are the symptoms and this is something that's kind of widespread, and to be able to help people from not getting it or staying home.
Okay, all right. Well, thank you very much for the therapy session. Now, Mark, is there anything that you want to stress to our listeners as far as dealing with the hysteria, dealing with the stress, dealing with the anxiety, dealing with the fact that you can't find what you're looking for at the grocery stores?
Yeah, I think in terms of dealing with the hysteria and the stress and all the information we're getting, I think it's important that we're taking that break from news and social media from time to time, because it can be so just just inundated, a whole bunch of information. And so I think it's important we're taking time to take care of ourselves, whatever that is for that individual. It might be reading a book, it might be exercising, it may be going for a walk, things to be able to take care of themselves, and that self-care is so important. So I think I would encourage that we make sure that we're taking some time to kind of get away from all of the news information that we have, because that helps sort of replenish us. It helps kind of revitalize us so we can then get back to kind of dealing with the issue at hand. So that would be one piece of advice.
All right. Well, thank you so much. Ladies and gentlemen, once again.
Does it for me.
Watching Andy Griffin.
He really does. I mean, he keeps, well, we won't even go there. But ladies and gentlemen, if you have any questions for Mr. Gronsky, you can get them. You can call 483-6111, or you can leave the question on Cape Fear Valley's Facebook page or Twitter, which is @Cape Fear Valley. So if you have personal questions, you're trying to cope, you're trying to deal, this is a time for you to get your question answered today. Now, one of the questions that I have is, and I'm going back on the medical sense now, what should we do if someone in our home has the virus?
So one of the things, if somebody is a positive case in your house, there's some great guidelines from the CDC, and you can call your local health department, and we will help walk you through how you can isolate in your home. So if somebody, especially if it's an elderly person or an immune compromised person, we want you to try to isolate as much as you can. So use separate bathrooms if possible, sleep in separate rooms if possible, don't share food, don't share utensils. You want to keep your pets away from that sick person. Although we don't think there's that animal transmission, we are still, just like we would the flu, we don't want you to cough on your sick dog. I mean, we don't want you to cough on your dog for flu. We don't want you to do that for this either. So as much as possible, keep that person isolated in your home if you're in a household that has more than one, with healthy people and people that have COVID-19.
Once again, we have a lady who called in, and she asked this question, and like her, she's a mother that has a small daughter that says, no, I can't see the germs. I don't see any germs. Why do I have to wash my hands so much? So once again, what do we tell this child?
I think one of the important things to recognize, I think we've kind of said it here, that part of that is that maybe you might not have the germs, or you might not be able to see that, but we're also trying to help protect others from not getting that and helping protect others from it not spreading. And so I think that's a message that I think we can share with some of our younger kids as well too, that even though you may not have it, but you might be able to help somebody else from not spreading that any further.
Okay. Now we do have another internet question. What can we do to boost our immune systems during this time, and will it help?
So go ahead.
So I think it's a few of the things we mentioned before. Sleep, eat well, hydrate well, multivitamins. Question of whether high dose vitamin C, who knows, even with common colds, there's been literature on both sides of that through the years, but it's not going to hurt. So that would probably be a reasonable recommendation as well. Other than that, there's nothing else that's truly proven. And the other part would be de-stress, because we do know that when you're very stressed, your immunity decreases.
So we have to learn coping mechanisms. Yes. Okay.
Practice mindfulness and deep breathing. We got a question this morning about whether a tea can help. And so I think you're right. There's lots of things out there, but a lot of them aren't proven. We don't know yet. So those basic things without making any purchases, you can sleep and eat well.
Well, we've got 5 minutes left in the show. So first, what are some measures Cape Fear Valley has taken to with this pandemic?
So I think that some of the most obvious to the public, one of them we touched on already, is we've restricted visitors at all of our facilities. The next thing is when any patients come in, they're immediately screened for respiratory symptoms. And patients with respiratory symptoms, fever, cough, shortness of breath, are separated from patients who may be waiting for other reasons. We treat these patients in areas where the staff expects them, and that way all of our staff is using appropriate PPE. Because one of the things that we have to make sure is that the healthcare team is there for this entire community. We can't afford to have 20% of our healthcare workers be sick at a time when, if this pandemic reaches extreme heights within our community, we won't have enough people to take care of you. So again, I'm going to emphasize stay home and use the hand washing. That's what's going to protect all of us.
All right, Dr. Zappa, this question is for you.
Okay.
They want you to talk about the ED. People are wondering what's going on with the tent outside.
Okay, so we actually have 2 tents connected out in front of our emergency department. And that is where we are currently evaluating patients with respiratory symptoms that are not so severe. So these patients are seen by a team that's in full PPE. We're doing flu tests. We're talking to patients. We're determining if any further testing is needed, like chest x-rays. We're seeing if they are sick enough to actually be in the hospital, determining if they would qualify for COVID testing or not. But let me emphasize, our tent is not drive-through testing. We are doing a lot. Lots of people are coming there thinking that's what we're doing. That is not. If you have mild symptoms, even if you've got the travel exposure, we are not testing you. We're advising you to self-isolate at home and giving you appropriate phone number for follow-up with our friends at the health department. They could advise you further and telling you what to watch out for.
Dr. Green, what is the health department? What measures is the health department taking?
So like Dr. Zappa's staff, our staff are at work because we provide critical public health services. So we know that people are still needing, we provide WIC benefits, so people still need that. People need access to food. So we do have staff at work because they're working alongside to address this pandemic. But we do have measures in place. So we just kicked off this yesterday, our visitor policy. So we're limiting visitors into our building. And again, one person, if with child patients or WIC patients can come along, but other than that, we have no visitors. We're also doing by appointment only. And so some health department visitors might be used to walk-ins, but we really want to be able to limit the people that are in our building. So we're not permitting walk-ins at this time. If you need an appointment, please call us and we will certainly get you scheduled for an appointment. You heard about the drive up test collection earlier in the show. And we are doing that as a pilot project to see how we might serve the community. So we're going to ongoing assess to see how that's going. But as we mentioned, not everybody needs to be tested. In particular, if you have mild symptoms, there's opportunities for you to stay at home and not go out into the community. So and then of course we are doing quite a bit of communication with the public. We want to be transparent. When we have cases, we report that immediately to members of the public, and we provide as much information as is as useful to the public without violating our privacy laws that are in place at the state and national level. So we want to be transparent, we want to be communicative and report, but we also know that individuals have across the country and even in our state we've heard reports about harassment, physical and verbal harassment. So it's our job to protect the health and safety of the public. It's also my job to protect the health and safety of those individuals who might be impacted.
Where can people get accurate information about COVID-19?
So we've talked quite a bit about this. So a couple websites you can certainly go to for credible information. The Centers for Disease Control and Prevention, the State Health Department website, the county's website mirrors the State Health Department website. You can certainly go to the World Health Organization. Those are some credible sources. We really want you to be cautious, even when you read a news story. See what those links go to. See if they have a cited source. Please be cautious. I'm sure quite a bit of what Dr. Zappa and Carolyn do is a little bit of rumor control. So we want people to be cautious when they're looking up information.
Okay, before we close out today's show,
They can also go to the our Facebook page,
Yes, yeah.
You'll see Dr. Zappa, you'll see Carolyn at times. Anytime we want to get something out, we do that too.
They can also, if they can run rumors by me and I can check sources, I'm willing to vet them for people if they have questions.
all right. And one final thing before we go to our panel and ask them the one thing they want to stress to our community. Jenny just let me know that Cape Fear Valley just shared on Facebook in the comments section a good video that explains the virus to your kids. So I will definitely be checking out that video.
Comments for this town hall.
For this town hall, okay. So before we close out the show, going to each and every one of you, what is the one thing that you want to stress to our viewers and our listeners?
Practice social distancing. We know that this is a challenging time. We're in a new world order right now. So we really thank the public for doing your part to help. This is not a Carolyn, Dr. Zappa, Dr. Green effort. This is a community effort. And so we really appreciate the work that you're doing out on the front lines as the members of the public practice that social distancing.
So I would underscore that and add, testing will not change anything. 99% of us, if we get the virus, we're going to do fine. Even if I had the ability to test you rapidly, which we don't, I'm still going to tell you, go home, self-isolate, use over-the-counter medicines. The one point, though, that I want to make sure everybody realizes is during this time, our emergency department, that is the busiest in the state and among the 10 busiest in the nation, continues to take care of all the other emergencies. We have to be ready to handle that every day. That hasn't stopped. So please, especially during this time, only come to our emergency department if you truly need care emergently. Please don't come just to ask about being tested, and please don't come for routine and chronic problems. Our resources will be stressed maximally, but don't worry, we'll be there for you if you have an emergency.
Okay, Carolyn.
We as what we do, we're members of the community as well. All of us, everyone who's a member of this community has a very special opportunity here to stop the spread of this disease. I'm mirroring what both of my colleagues here have said, in that now is the time to stay at home, not just if you're sick, but if you have the opportunity to work from home, talk to your boss, talk to, your coworkers about how you can get that done. And if you absolutely have to report to work, practice that social distancing as much as possible and wash your hands often.
Okay.
Thank you.
And I would concur. I think social distancing is certainly important. I think the piece to recognize, kind of from a behavioral health perspective, is folks that are dealing with anxiety, depression, that sense of kind of further distancing might create some isolation or some additional fears or anxiety. And so my encouragement is, if you're struggling with that, is to try to reach out to individuals. It might be via FaceTime or other Skype or technology, but make sure that's a part of your routine, because at the same time, while we're dealing with this, needing to separate, that could create more anxiety, more stress for somebody who's struggling with depression, PTSD, anxiety. So making sure that you're using that platform to be able to communicate with family and friends. And if you need further help, please reach out to those mental health professionals that are there to work with you.
All right. Well, ladies and gentlemen, that wraps up our special edition of Cape Fear Valley's Making Rounds Live. I want to thank our colonels of COVID-19 for joining us today. Dr. Michael Zappa, Chief of Emergency Services and Associate Chief Medical Officer for Cape Fear Valley. Carolyn Nygren, Corporate Director of Infection Prevention and Control for Cape Fear Valley Health. Dr. Jennifer Green, Health Director for Cumberland County. And Mark Gronsky, and he's with Cape Fear Valley Behavioral Health. Thank you all so much for your valuable time and being on this show today. We greatly appreciate it.
Thank you.
Thank you for having us.
Now, ladies and gentlemen, if you have a topic that you would like for us to discuss on the show, you can drop us a line at Cape Fear Valley or by way of their Twitter, which is at Cape Fear Valley. If your church or organization has anything that you would like to get on, get it to us 3 weeks in advance. And our next show is Tuesday, April 14th. Cape Fear Valley is Making Rounds Live. Thank you all for joining us. Bye, Facebook. Thank you all for the time.
Stay home.